Scoliosis is a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. While scoliosis can be caused by conditions such as cerebral palsy and muscular dystrophy, the cause of most scoliosis is unknown. The different categories of scoliosis include idiopathic, congenital, and neuromuscular. However, there are different variations within each of these categories, including lumbar, thoracic, thoracolumbar, and combined scoliosis. Each can immensely impact the structures of the body in that region. Scoliosis can impact the body and its organs in multiple ways. As the condition worsens, more noticeable changes occur, such as uneven hips and shoulders, prominent ribs, and shifts of the waist and trunk. Scoliosis can also lead to chronic back pain, especially in adults who had the condition as children. In cases of severe scoliosis, the heart and lungs can undergo damage due to the rib cage pushing against the heart and lungs, causing difficulties in breathing and the heart's ability to pump. The case study being presented focuses on the impacts of congenital scoliosis and its effects on a woman named Jane. She was born with the condition and has grown up into adulthood with this abnormal curvature of the spine. This study will address the effects on Jane's body from infancy to her present age of 30, as well as possible treatment options. Congenital scoliosis, which is often non-hereditary, is the most frequent congenital deformity of the spine and is caused by anomalous development of the vertebrae. Before Jane was even born, it was discovered that she had congenital scoliosis at the mid-thoracic level through ultrasound at about 5 weeks after gestation. This occurred due to mutations in the development of somites, the precursors to vertebral bodies, which can lead to vertebral deformities. These deformities can be the result of a failure of formation of the vertebrae and structures, such as hemivertebra, a failure of segmentation, which results in abnormalities of the intervertebral disc and includes unilateral and segmented bars on the anterior and posterior sides of the spine. This is what Jane was later discovered to have after birth. Further impacts on Jane as a fetus also include environmental factors. At the time of pregnancy, Jane's mother had maternal anemia, or low oxygen tension. This lack of oxygen to Jane as a fetus has been found to play a large role in the disturbance of somite formation and therefore could be the main contributor to Jane's condition. Although the type of scoliosis was difficult to diagnose prenatally, it was very important for the doctor to keep a close eye on any co-occurring conditions, including congenital heart disease, spinal cord dysphrasism, or kidney malformations, as they are frequently associated with the condition. Upon birth, Jane's condition was confirmed and she was diagnosed with congenital scoliosis. The physician described the curve according to its shape, C or S-shaped, the location of the curve, thoracic, lumbar, or thoracolumbar, the direction of the curve, left or right, and the angle of the curve. The degree of each curve is measured by the Cobb method. The Cobb method determines the angle of the curve by measuring the angle between the two most slanted vertebrae. Scoliosis is defined as a curve larger than 10 degrees, regardless of the spinal level. The direction of Jane's spine was right and C-shaped in the thoracic portion of her vertebrae. Her curvature was initially measured at 23 degrees using the Cobb method. Serial clinical examinations for Jane's condition began and were conducted every 6 to 9 months from birth until she was 5 years old. Because the first few years of life are when rapid spinal growth occurs, Jane was monitored very closely during this developmental time period. The process involves using clinical radiographs as monitoring tools and comparing the new ones taken to the original radiograph to note any spinal changes. These radiographs can be analyzed by measuring the Cobb angle, assessing the rotation, and measuring the rib vertebral angle. As Jane entered childhood, her serial clinical examinations of her condition continued from age 5 to 10, with scans still being taken and analyzed every 6 to 9 months. Despite Jane's condition, she was a motivated child and wanted to keep up with her peers, especially in gym class. She was especially interested in the gymnastics unit, loving the cartwheels, somersaults, and flips. Despite Jane's interest in gymnastics, she found herself feeling pain and discomfort in her lower back and spine. After consulting with her doctor, Jane was told she shouldn't be participating in such high impact and performance sports. In fact, the impact of hitting the floor put an increased amount of pressure and compression on the spine, and overall placing significant stress on the spine, which can worsen the condition over time. Jane withdrew from the high-impact activities in order to be proactive about her condition and prevent further damage. As Jane grew up over the years, her condition was monitored more closely as she began to go through puberty. Because puberty is another developmental period where rapid spinal growth occurs, the congenital curvature must be monitored closely in order to correctly diagnose the progression of the condition. For someone of adolescent age, the serial clinical examinations are performed every 6 months from puberty to the end of skeletal maturity. Around age 12, Jane wanted to become more involved in a group sport for an after-school activity, but struggled to find one in which she felt comfortable and that was safe to participate in with her condition. Further, Jane began to experience an increased amount of back pain and during this time period, as well as difficulty breathing. Jane and her parents consulted with her doctor, who recommended swimming as a safe endurance sport for someone with a 52-degree curvature. Swimming is good for general strengthening of back muscles as well as breathing function. Overall, there is less pressure on the spine due to the buoyancy of the water, with movements that are less jarring that cause less pressure on the spine. Swimming is a common therapy treatment that is used for patients with scoliosis who are experiencing back pain. This pain is a result of the abnormal posture straining muscles and causing them to become tight or fatigued. Muscles that are often impacted by scoliosis are rhomboid major, rhomboid minor, trapezius, and latissimus dorsi, all originating on the spine. After discovering that Jane's curvature had progressed to 52 degrees and that she had developed restrictive respiratory disease due to an increasing chest wall distortion, doctors were motivated to perform surgery in order to stop the progression of respiratory disease. In addition, her doctors performed echocardiography to ensure proper function of the heart. Oftentimes, structural cardiac abnormalities can be seen with respiratory problems. However, in Jane's case, she only developed respiratory issues. Throughout Jane's life, she has experienced multiple complications, including decreased lung function, back pain, and problems with day-to-day activities. Around the age of 16, Jane qualified for vertical expandable prosthetic titanium rib, which is the insertion of a titanium rib to help the lungs expand and to correct the curvature of the spine. This procedure will help move the hemodiaphragm distally, increasing the overall function and growth of the lungs within the chest cavity. Today, Jane continues to monitor her condition with doctors due to the high complication rates associated with any spinal fusion technique. This could include rod migration, infections, or even further spinal injury. Although she cannot competitively swim anymore, this does not stop Jane from enjoying a leisurely swim, which she has been cleared to do post-operation.